contraception per se was mostly illegal. It didn't become legal until even after the pill was introduced. So women had a very hard time. Many family planning clinics like Planned Parenthood, and we're just one of many, have gained some funding from Title X, which was a program that the U.S. government initiated under Richard Nixon, which allotted money from the federal budget for family planning purposes, which made contraception and counseling for abortion services available nationwide, where it had not been before. The fundamentalist side of Christianity in particular is very much opposed to contraception and abortion, and they're very vocal. It comes in the form of, for instance, the College of Catholic Bishops, who dictate to their parishioners that they are not supposed to use contraception. And they work with state Republican parties primarily to introduce laws in the states, either on a local, state, or national level, that make access to contraception and abortion really much more difficult.
So our funding, depending on who's in office, is often cut. And so we, for example, can no longer give free services to a lot of people. We actually have to charge full price for an office visit now just to get on birth control, where we used to be able to do it for free. A lot of the women we see for abortions say things like, well, I was on birth control, but my insurance doesn't cover it anymore, and so I ran out, and I mean, of course.
Well, unfortunately, not just at the national level in Congress in Washington, D.C., but at state levels as well. Primarily, it's white men who make the decisions about what women can and cannot do as far as their reproductive choices. And it really has a tremendously adverse effect because most of them are older men, their wives are past childbearing age, they are not really sensitive to what women are going through today. They come from a much more conservative background, having come through the 50s and the 60s when there were more restrictions on sexual behavior. We're in a little bit more liberated time in the 21st century where young people have more freedoms. And I don't think there's a clear understanding about what limitations they put on young women and what that actually does long term.
Because men can just literally walk in and grab a bunch of condoms from a basket, where the women have to have an appointment to get the birth control.
A a lot of young women have to make choices, particularly if they're in high school or college. They don't have a lot of money, and they have to make choices about where they spend their money. And some of them are not able to afford contraception if they have to pay for it out of pocket, because it can average between $40 and $60 a month.
Demographics for someone who is working barely and has insurance that doesn't cover anything, she'll be paying full price for her birth control, which is a lot of money.
For instance, young women in Mississippi, particularly African American women in Mississippi, have much more difficulty accessing contraception than, say, a Caucasian woman in Seattle, Washington, which is very progressive, where contraception is readily available. Women who live in the midsection of the country, from Missouri west to Utah and Idaho, have very difficult times because there are not that many family planning clinics. They can go to their doctor and have a prescription for contraception if they go to an OBGYN, but many of them don't because they're young. They don't have health issues per se, so the only thing they would really see a doctor for would be to prescribe contraception. And then if they're on their parents' insurance, they don't want their families to know that they've gone to get contraception. So there are a lot of problems, and the accessibility is just one of the big problems for young women finding contraception and finding it easily.